So yeah, welcome everyone. We've got two brilliant speakers here, so I'll keep the intro as quick as I can. Just a quick note to who I am. I work for Sifted. We're a publication covering European tech and startups. So if you are a European company or investor or American company working in Europe in this place, please do get in touch with me. I'm Tim at sifted.eu and I'm covering this sector as well as I can. So without further ado, we know that we're here to discuss the incredibly important issue of PTSD and what psychedelics and other progressive therapies can do to help people suffering with it. So to intro our two speakers, we've got Keith Abraham, who is the CEO at Heroic Hearts UK. They are a non-profit organisation working with people from the military and emergency services to help them learn about progressive therapies to help them with their own traumatic experiences. And Keith's organisation is also active in the US and is doing significant work because, as we know, veterans are a hugely important part of the game to get policymakers and lawmakers to take these kind of treatments seriously, particularly more conservative-minded ones. So the work that Keith is doing is super important. And we've also got Natalie Ginsberg here. So she is Global Impact Officer at MAPS. I'm sure MAPS don't need much introduction for most people here, but they are the Multidisciplinary Association for Psychedelic Studies, going since 1986 and been doing considerable work on PTSD since then. As just mentioned, they've got an MDMA trial going on, which is in phase 3, I believe. Yeah. And yeah, we'll come to that a bit later. But just to kick on, Keith, tell us a bit about your own experience with PTSD and how that has led you to this conference today.
So I was never diagnosed with PTSD, I'll say that much, but from my subjective experience, I would suggest, and I believe that I had PTSD. I'm a veteran of the Parachute Regiment, and I had combat experiences in Iraq and Afghanistan. Some of them were pretty difficult. Over a 9-year career, I lost 16 of our unit. Not all in combat, admittedly, but still it's a difficult environment to work in. And not too long after, I realised some of the symptoms I was experiencing were not normal, and I was in an unhealthy place. And I tried all of the normal conventional responses to a request for help, which was SSRIs and talking therapies and whatnot. And none of them really worked. I started to spiral and get a little bit worse every year, and before long I left the military. I walked straight into a job at JP Morgan, hoping that I would find some peace and some calm, and I was so naive. And it was while I met some dear friends there, it was obviously a difficult working environment itself. And so it kind of compounded my experiences. And before long, friends of mine in America suggested that I try something called Ayahuasca. And being a military man, I've never heard of it in my life. But I'd reached a stage where I was pretty hopeless. And so and by hopeless, I do mean I was in a significantly difficult place. And so I booked a flight, took holiday from JP Morgan, just said I'm going to Peru. And I turned up, some very kind people took me deep into the jungle just on my own. I was in a little wooden hut for about 10 days in the jungle. A shaman came and visited me, gave me 2 doses of ayahuasca over 3 days. And I left that jungle and I knew that I was healed. I knew I was healed. That was my first thought. I recognised that I'd been healed and I was ecstatic. And then the second thought was, this medicine works. We've got to do something about getting other people access to this medicine. You know? There's not only ayahuasca in the jungle, then there's MDMA and psilocybin and whatnot, but we've got to get people access to these medicines because they work. So very short, that's my experience.
Yeah. Well, it's amazing to hear about that moment of clarity and healing. And I think we've heard a lot on the stage about the brain chemistry that goes into those moments, but just give us a little bit more on that experience of feeling like you had been healed.
Well, the way it actually happened in ceremony, just to keep it brief, I'll do my best, but I found myself confronted by what I recognised as the spirit of the medicine itself, so the spirit of ayahuasca. In that instance, presented itself as an elderly lady, and she ran me through my whole life of behaviours and mistakes, and asked me the question, was like, do you believe that these behaviours were healthy? And obviously they weren't. The next question was, would you like to not behave like that and behave in a healthier way? Yes, I would. I'm here for that. And she then showed me, we revisited all of the significant traumatic events in my life, and where there was conflict, not just combat conflict, but relationship conflicts. And she showed me my behaviour. Then she showed me how she would behave in my place. And then she suggested that I try and recreate that behaviour. And this is all in the dream state, you know. And if I passed, I went on to the next lesson, and we were going through these lessons and tests. And if I failed, I had to go and revisit the lesson and the test. But it was all done very compassionately, very nurturing, which I needed. I didn't need that real brutish approach. I needed a hug. Which most people do, to be honest. And so eventually, over what felt like lifetimes of lessons and tests, I passed enough tests where I just thought, you know what, I think I'm at my capacity for passing these sorts of tests and lessons out. I'll get on with my life now and try and integrate these lessons in my waking life. And I've done my best, and it's worked out pretty well. And so Heroic Hearts stemmed from these. Actually, to give credit where credit due, Heroic Hearts is actually a US charity originally set up by Jesse Gould. He could sit here and say the exact same story as me. It's nearly identical. So credit where credit's due. It's an American. Jesse founded it. I just run the UK branch.
Got it. So a very profound but compassionate. There we go. So yeah, a very profound and compassionate examination from Mother Ayahuasca by the sounds of it. Now, what I want to ask is, you obviously come from a military background. You touched on earlier this was not something that was necessarily in your frame of reference. Tell me how you go about approaching veterans who might need this, but who might be completely turned off by the more spiritual side of it. Have people dismissed you as a woo-woo hippie? How has it been?
Yeah. So I'm a hippie at heart anyways. But yeah, I've lost friends from this. I've definitely...
Can you put your mouth near the microphone?
Like this? So, yeah, I've lost friends because of this. Is that better? I've lost friends because of this, and but I've also made a lot of friends because of it. You've got to know your audience, and language for audience is important. That's true here as well. But we normally wouldn't touch on too much of the spiritual language when we initially start the conversation with veterans groups. It's more about basically what they trust. It's about trust, and what they trust is a personal testimony. You know, they trust that more than the medicine, more than the data, more than the research, more than all the science, which I still support, obviously. But these people, these individuals, they trust the personal testimony, and they trust another veteran to tell them that this is safe and this is effective and that there's hope here. You know, it still might not work, but there's hope. And so we're careful with the language, but we can't, you can't reach everyone, you can't please everyone, so you just accept that. But there's been some good reception, and we just got back from a retreat as well, which was spectacular.
I'm sure. And perhaps we'll have time to touch on it a bit later, but I want to bring Natalie in because, as we said, you've been working on PTSD, your organisation, for a long, long time with veterans as well. So just tell us a bit about what MAPS has done with veterans and PTSD and some of the insights you've had from being exposed to some of those, what would you call them, sort of study sessions, and, witnessing how MDMA particularly can help people with PTSD.
Sure. So MAPS is we actually just finished enrolling for our final phase 3 of our study, evaluating MDMA-assisted therapy for the treatment of post-traumatic stress disorder. We have many veterans who are in our trials, but it is not exclusively with veterans. So far, we've had really promising results. 2/3 of our participants from our phase 2 trials no longer qualified as having PTSD after the trials were complete. which when you compare it to the other currently approved psychiatric medications to treat PTSD in the US, that's Zoloft and Paxil, they're around 50% effective in reducing symptoms, but not eliminating them. We use something called the CAPS score to evaluate PTSD, but it's important, as you mentioned, you didn't have a diagnosis, and this is not a perfect thing, but is the score that we're using. We have a series, our protocol involves sessions without the medicine. First, you have 3 sessions with 2 therapists actually at a time without the medicine to prepare. And then there are 3 separate sessions with the medicine that are 6 to 8 hour long sessions where people are invited to put on blindfold and music and go inside, and kind of often, as you're describing, people are revisiting different sites of trauma. Something that was really interesting to me, as I had the privilege of watching many of these session tapes, we video the sessions, and what really struck me, even watching many veterans tapes as well, is how often early childhood trauma and other instances of trauma would kind of be the first to come up to be addressed. And that was often really surprising for folks. And I find it really interesting working in the advocacy and education space that it's very difficult for people to talk about some of these early traumas, sexual abuse, family abuse. It's been quite hard. So we actually find that people who are most willing to share their stories often are veterans as well, to talk about their experience in war, and that feels something that's also more kind of understandable in some level for people. But something I think that's often really missed when thinking about trauma and PTSD is actually that the highest rates of trauma exist in communities that are most socially marginalized. But these communities also have less access to diagnosis, even to treatment. There's often trauma that's intergenerational and compounded by ongoing trauma from policies, it's culture, things like racism, misogyny, how that impacts people's everyday. But often the PTSD diagnosis actually doesn't acknowledge all of that. And when we're talking about different medicines, you mentioned ayahuasca, understanding the trauma many indigenous communities around the world who have stewarded these medicine practices for millennia, are experiencing a lot of trauma, at least in the US and elsewhere as well. So kind of, thank you, yes, it's something that we sometimes can lose a bit of sight of, as it's really exciting with hundreds of new psychedelic companies emerging, but to really kind of hold this greater picture of, especially when we're dealing with trauma, who is suffering, and making sure those people are represented in who's designing the research, who's the therapist, who's this whole context. And it's something, very difficult sometimes to see that many of the conferences that we attend, where folks have the privilege of being able to work in this field, don't always reflect the communities that are really most suffering. So, but that is, being on this panel is actually not just that, having your experience as a veteran is really so essential. So I'm really honored to be on this panel with you.
I think reciprocity is important.
Do you want to speak up a little bit?
Reciprocity is important, not to forget where these medicines come from and who is stewards of these medicines themselves. So we, as an organisation and our collaborative partners, I know that we're intent on trying to help not only the curanderos or the ayahuasqueros or the vegetalistas, but their wider communities. A lot of them don't even have drinking water. I know I'm getting off topic here, but there's a lot of help that's required by the indigenous people themselves. So that shouldn't be ignored, considering the audience here as well and the money that's around. The primary concern is healing, but it doesn't just have to be. I know I'm a veteran advocate, but it's a small cross section of Western society. We've got a whole world out there, and we've got a responsibility.
Absolutely, and I think this touches on, we're in a room where there's a lot of companies who've had millions and millions of dollars in VC backing, and they need that money to get these drugs through the clinical trial process. to get them available from a doctor, right? But Natalie, what would be your message to those companies who are working towards this medicalized clinical setting for psychedelic and other progressive therapies? How should they be dealing with the fact that, for one, people like Keith have got huge value from a ritualistic and indigenous setting to take these things? What should be their approach, and what should be their approach to reciprocity?
Well, first, I'm really proud working at MAPS, that our mission is developing medical, legal, and cultural contexts. So right now our primary focus is getting MDMA approved in the medical context. We're simultaneously working for decriminalization, drug regulation, education, harm reduction. It's really a holistic thing because, in the US especially, people do not all have access to the medical system. It is encouraging being in the UK and hearing how things are a bit different that way, and certainly in other places around the world. But decriminalization, first and foremost, ensuring that no one is still being incarcerated for these substances is so essential, and such an essential...
You have a big fan.
Thank you. And, it's something that I really invite those of us working in the industry to really consider, because the traditional approach from pharma is actually to oppose decriminalization and regulation and to protect your market. That happened in cannabis. I worked in New York to pass medical cannabis many years ago, like 9 years ago now, and a vaporizing company came in and convinced the governor to cut out smoking and make it like vaporized only, and just seeing how that was even a small, at least we passed it, and other times it's been even more harmful. So just really considering how it actually could help your business as well to support an ecosystem where no one is getting incarcerated. And I know, people might have more reservations around a regulated market, and I'm really happy to talk more about that with you, but let's really start with not opposing decriminalization. We don't need to be doing that. And if people are unsure of what that means, MAPS has a lot of information, and I'd be really happy to talk more about drug reform and how that actually can support this medical world that we're building.
Sure, I don't know how much time we've got left, Matt, but 5 minutes, okay. Keith, let's just go back to you. Give us a little bit of a description of what this retreat was like with the veterans and what it tells us about why we should also give space to treatments outside of just the clinical sphere and why those have value.
It was wonderful just as an individual. It was wonderful to bear witness to the healing that these veterans received. And my team deserve a lot of credit for all the hard work. They didn't get to witness any of the healing that I did, because I was there myself, and unfortunately I was the only team member there. To see the look on the faces of these veterans after they'd received their healing, it was just, I broke down. I nearly cried outside where I was regaling that story just while we were outside on the fire break. But I broke down in tears again when I saw their faces after the ceremony the next morning, just because it was so, these are big, hard men, big, hard men. These men have killed people. We've lost our friends. And all of a sudden, they're a ray of light walking into the room. They're just like a beacon walking into the room, and you just think, oh, we don't take any money out of this charity. None of our team get paid. That is some payment just to see that. So, talking about the retreat very briefly, we actually only had 4 veterans manage to get to the jungle. That was more than enough in the end. It was perfect. They had 3 ayahuasca ceremonies, 2 consecutive, and then a day off, and then a 3rd ceremony, which is incredibly hard work. It's very hard work. I drank twice myself, very demanding, but incredibly rewarding. And now that we're back, we've started our integration process. We've got an integration coach who's obviously coaching me as well. And that will continue for the next couple of months, and we're in private conversations with each other because we're essentially friends for life now. It's hard to ignore those connections and relationships that you've gained in ceremony. And I think, maybe to answer your point, I think maybe the clinical setting lacks that opportunity, but there's still benefit in the clinical setting because some people don't want to go to the jungle. So it's client-led. If you don't want to go to the jungle and you're safer on a bed in a clinic, go for it. But I really support the idea of a pilgrimage towards your own healing and that commitment, that level of financial and physical commitment and emotional commitment to go and get your healing, because it's a hard slog to get yourself out there, you know. So.
I might mention that a huge value I see in group work, especially with ayahuasca, is this community that you have after. You know, I'm trained as a social worker, and group therapy, even outside of these contexts, is incredibly valuable. And that is actually something that MAPS is starting to explore as well. And to be clear, I absolutely don't think this should only exist in the medical framework, and it's so essential. People have all different ways of accessing this in safe ways. And I learn a lot from ceremonial use, and I'm excited that we are trying to integrate that a bit more into our research by looking at group work. Because, you know, even if you said you have an integration coach or a therapist afterward, that's still a lot of responsibility for, you know, to put onto one person. When you have a whole community, a WhatsApp group, potluck dinners, it's really more of an authentic kind of way of building community and healing. So, and it's also more cost effective. So I think that's really something to consider. And I guess I might mention just along those lines that when, you know, with our research, we only have 3 sessions of MDMA, and 2/3 of people are able to move on at that point. You know, some people might benefit from more, but I'm really proud that we're not incentivized by our work to try to have patients ongoing and coming back, you know. And MAPS is a nonprofit, but we have a fully owned public benefit court, and that allows us to prioritize public benefit over profit as our #1 motivation. And that's something I also really invite us to be really considering. Of course, I know not every company has the ability to operate in the same way as MAPS, but to be really considering if people are able to benefit from 1 or 2 sessions, not to be kind of trying to create more and more opportunities like that. Yes.
Okay, just a final question before Matt kicks us off. But you mentioned earlier that veteran PTSD can sometimes seem like the most visible tip of the iceberg in accessing groups who have trauma. What can we learn from what both of you have been doing in terms of winning over hearts and minds and educating people about the possibilities of this therapy, in terms of getting the word out to other sections of society in what is quite a traumatic society to live in?
I would suggest that personal testimony is pretty convincing, but also there's some work on the political front that needs to be done. I know Crispin's, who's one of our. I think personal testimonies are really important and very convincing. Perhaps more, I suggested earlier, it might be more convincing than data for a lot of people. But I think, and I know Crispin Blunt's here somewhere. He's one of our trustees. There's some work to be done politically here in this country. So we support his work, and the CDPRG, big fans of their work in drug science as well, and the work that they're doing to try and push this over the line in this country. But I do believe that there's not enough personal testimonies that are involved. All of the data in the world, it seems to be getting rejected. To be honest, I hear some of the some of our friends are banging their heads on the walls trying to get this over the line, being data-led, research-led, but maybe some personal testimonies might change some hearts and minds.
Natalie, any thoughts on that finally?
I completely agree, and I guess you asked about how do we go out and find folks, and I guess I'm a community organizer at heart, and I think about how do we build community, how do we identify groups where we can go and be learning and building there and inviting them, to participate rather than expecting people to kind of come to us. When we're talking about trauma, which groups are working with refugee trauma? What are they doing in that sphere? How could psychedelics be supportive in that kind of collaborative way? I guess just really inviting us to think with that bigger mind. And people are often quite receptive because, unfortunately, there's so few treatments that work. So I've approached people that thought I was like, what the heck are you talking about? And a few weeks later, they're actually starting to do research with us. And I think, actually someone I'm thinking of is Dr. Monica Williams, who is a pioneer in studying racial trauma and establishing basically that PTSD can manifest from experiences of racism. And it's been really tremendous for all of the amazing work that she's done, and she's been able to kind of plug in the psychedelic field. So I guess, really just about building community and from a space of where you're wanting to go and finding partners there.
Brilliant. We'll have to wrap it up, but a big hand for both of our brilliant speakers here.